Hello friends, here I am going to show a hysteroscopic cervical canal recreation. This was a 25-year-old girl having secondary amenorrhea. That means no period since the past 1.5 years. She had been given multiple courses of progesterone as well as oral contraceptive pills. However, she did not get any periods. Ultrasound revealed a hematometra, that is collection in the uterine cavity. There is no history of any previous surgeries or any previous treatment, surgical treatment taken for this particular ailment. At hysteroscopy, as you can see, there was a blind pouch in the cervical canal with no opening noted anywhere in the upper as well as the lower cervical canal. However, what we did find was a dark spot, a area of probably blockage of the cervical ostia that is seen here on the screen, which most likely appeared to be the blocked ostia. So what we did is to introduce the hysteroscopic scissor at exactly that particular point and tried to create the cavity of the cervical canal. The hysteroscopic scissor is just 3 mm on opening wide, and it is a sharp instrument which, when used properly, gives us fantastic results in these cases and in cases of Asherman syndrome. Here, as you can see, is we are just trying to gently open that cavity and see whether any blood is coming from that. After that, the scissor did not go any further, so we cut it from the sides to make the aperture a bit bigger, a bit larger. Again, we evaluated whether any outflow was noted from the uterine cavity, which was not. So we tried to put the hysteroscope, it's a 1.9 mm hysteroscope or office hysteroscope in, but again that did not go. So we did open up the aperture a bit more by cutting it on the sides, thereby allowing the hysteroscope to go inside. There again, as you can see now, the hysteroscope has been able to navigate it through the cervical canal a bit inside. However, it just went in a couple of millimeters and did not go any further. So what we did is make the opening wider a bit, and then after much efforts we could finally be able to put the hysteroscope inside. Here, as you can see, there was a black spot noted, which was a sign of relief for us because most likely that was where was the collected blood in the uterine cavity. Here, with the pressure of the hysteroscope, you will shortly see the splitting of the adhesion band to the top and to the bottom, and with pressure, we could navigate a bit more inside the cervical canal, which was completely obliterated. Again, with gentle dissection and opening of the scissors, we cut those adhesion bands a bit more and again tried to push the hysteroscope through that blocked tube. And gradually, with more splitting, finally we were able to successfully enter into the uterine cavity. Here, as you can see, is all the collected blood, and on the external view, this is what the blood has come out from the cervical canal. After this, we gave her a nice wash with saline so as to just clean off the uterine cavity of the collected blood from almost 1.5 years. This is again hysteroscopic view after giving a nice wash with saline, and as you can see, we are well inside the cavity. We can still see some blood clots, and with more saline irrigation and by increasing the pressure of the irrigation, there we can see finally one ostia on one side. On rotating it, there is a small prominence at the fundus. Then afterwards, the cavity was completely cleaned. We did a DNC and came out. Thank you so much.